Hello, very good. How are you all? Well, a lot of people ask me where you get so much information about tumors. Well, look, I'm going to explain today not to get information from tumors that I notice giving information from that tumor to the other's information. What do I do? I look for information on the internet, but I look for it on Google Academic. It's not a no, it's a normal Google. You have to put on Google Academic, a special Google opens that is full of PDFs, permits, doctors, where doctors study. It is exactly Google where doctors study and there where scientific files and everything are uploaded. And that's where I look for the information. That's why there are days when I find it very quickly and it already takes me a long time to find it because almost everything is in PDF. Then I have to read myself. I have to give myself entire conferences that are recorded there to look for information. But hey, I think that the one I am finding and the one I am publishing is great. Today I am creating the balance. I am finding it quite well. I think that the information I find is quite explanatory information. I explain it a lot. Sometimes maybe I pass by and tell the truths as they are. But if you ask me, it is a tumor that is cancerous. What do you mean you have cancer? What has no cure, which is 5 to 7 months? And you ask me what is going to happen to me. Then I explain it. I don't care. I say what is going to happen to you. And what is going to happen to you, unfortunately, because it is 5 or 6 months to live. I am very sincere, like schools as they are, humorous are unfortunately. In 5 or 6 months you leave and nothing else can be done. There are people who don't want to know. There are people who want to know. People who ask. It's not that the doctor doesn't want to tell me or they have told me and I don't believe it. Is it true that I have 5 or 6 months to live? Well, unfortunately, I am very sorry. Your tumor is 56 months old, 9 months old, lengthening it out a lot. Nothing else can be done. There is no cure. You cannot operate because it is already there. You are there for me, yes, yes, and nothing else can be done, and no. And I am sincere, and I say it because you ask me to tell me just like you write to me on eBay. But they hurt me, of course, and when I upload the video and hear it from the person, I said, damn, what a barbarity you said. But the person who wrote to me that I did it for him, he wanted to know, and I wanted to know the truth. So that's what I explained, but I explained the truth. I don't explain anything other than the truth. I always say it too. I'm not St. John's wort either. Yes, very much. But when I explain a tumor 100%, I give information. I read and I study, and now I see a car, let's say almost an expert. How cerebral is it? Because I have been reading for 7 years and looking for information for many people. And in the end, he takes a little bit of everything. Do I have such a tumor? Well, look, tumor soup, there are tumors that have to be compared to awake people. That these tumors, not me, I wouldn't dare. Honestly, I don't know how there are people who do it because they have to do it. You have to be awake and they record you awake. But hey, that's what there is. Technology is like that. It opens you up and you have to play music or you have to do things to stimulate. You don't have to touch your brain. I had not such an exaggerated YouTube when they gave me neuralgia that burned me. They gave me local anesthesia, but I was awake. Then they pricked me, and when I complained, they injected me with Botox, or I don't know what. It seems to me that it was Botox that I injected to calm the nerve. And they did it to me alive and being inside a hospital, and I wouldn't open my head. I was just pricks, but it's within the compliment to see everything from doctors. Okay, they stun you a little. But talking to the doctor, the hour it lasts, I'll give you here, we'll prick a little bit here, I'll give you from here, we'll prick a little bit there. And when they prick you right in the nerve, well, of course, the doctor follows the nerve and maybe he failed, but missed 1 millimeters and nothing on the other millimeter. They already got on your nerves and I painted you. So they impressed me when they made the first impression, the first operation like that. I didn't live it. I was scared. But then I saw that it wasn't that long and I did it and nothing. What I'm telling you, I'm very sincere. Sometimes I'm too sincere. Like when I explain the Centalino thing, well, look, well, I explain it because it's what there is. And I want you to know it, and I don't want to deceive anyone. I don't want to tell one, you see the doctor because you find out about fentanyl. You get into fentanyl, and after 6 months, you want to get out of fentanyl, and you say, man, that having fentanyl to live. Why? Because it is addictive. Like all the hosts are addictive, because the fentanyl is very addictive. And I say it, I tell the truth, and I don't want to tell lies or lies. I am very sincere. Like when I cut off my head, I say it like when I am well. I say it when I am not well. I am in bed, and I make videos in bed, and I always say that I will record on my channel the good and the bad, and my channel works, so I explain the good and the bad. Whoever doesn't like it, let him leave, and whoever likes it, let him stay. Because I'm honest. When something hurts, I say it when it doesn't. When I'm in bed crying, I don't say that I have recorded videos of myself crying in pain, that they have recorded videos of me crying in pain. I know how to upload them to the internet so you can see what happens when you have a headache attack. That the neural that enters you, the one of the trigen that is like that is not for. That is for that. It is the worst that can enter you. I hate that one when it comes to me. It enters. I can't stand that one. That one is unbearable. It is a thing that hurts a lot. It is the strongest damage that I have. The one of the trigen cannot be endured. They are cramps, electricity, pain, everything on the side. It is a thing to endure, but I say it, I explain it, I suffer it, and I upload it, and you will see it. When I'm suffering, but you also see when I'm happy, like today, because I'm happy, I'm recording a video. I'm happy. I like to record these videos also when I'm happy, when I can walk or I'm walking, like I'm putting a balance sometimes. But I walk and all this, I like to explain why teach. So I like that you see it and that you understand that things are as they are, and sometimes, or you have to tell the truth because if you deceive the person for what, they can tell the truth. Furthermore, when the person enters my page, he enters looking for the truth because my dad is for the truths that are your brain molds. And there I explain it to you. I explain to you the good and the bad. I explain to you that you have a 20% chance of going well and 70% of 175% of going bad. And that's what there is. In either you're at 50% or you're going to come out okay. It's a risky operation. Well, what are you going to come out of the fucking mother? But you are going to do that like mine. Mine was a very risky operation that I was going to lose my ear. I was going to lose my facial. I was going to have shyness. I was going to have some altigenes inactivity. No, nothing but this loss of balance, headaches. But I'm alive, but I have all this. And your good model was to come, right? But he left me all this. On the other hand, there are humors that are worse than mine, and they don't let you be secular. They take it away from you. You have been worried for 5 years that it won't come out again. It won't come out and be fixed. You already have your life resolved. You can now continue doing a normal life and everything about me. Unfortunately, mine was good, but now I can no longer continue leading a normal life. Why? Because I don't have balance. I have pruritus. I don't have facial. My eyes are dry. I don't close my eyes well. Dust gets in me. Everything gets bad. I get eye infections, and so we can have headaches every day. The doctor sees us every week, every 15 days, and he lives us and lives us. I can't take a trip because if I feel bad, I just entered the will of the world. I can't ski because I used to love everything I can say about skiing. The car I love to drive. Now here I take less than one car because I'm already afraid in the car. I left the motorcycle because I was afraid to take the motorcycle. I didn't take the bicycle anymore because I was afraid, because I always took it. And I said, I know it was amazing, but I was afraid because I didn't calculate well. When I turn around, I suddenly lose my balance and I fall. And these are things that happen to me, that unfortunately happen to me, that everything is already going smoothly. I am now recording this video with you perfectly. I'm losing my balance and falling to the ground suddenly, and that's what happens to me. And this makes me very angry. That's why I like to explain truths. This, what are they like? Well, and the bad thing is, today I don't have a headache because today I'm happy, but maybe tomorrow I'll wake up with a headache and I'm in bad shape, but I record a video and I record a video. I'm looking at a headache and my things are like that. I'm very honest and I like people to be honest with me too. If you don't like it, huh? Well, we don't like your lives for this. So I will try to improve too if you don't tell me anything. Do you like it? Well, I say, well, we are going well on this path, but the other day I published one from a person who asked me, And I told him, look, unfortunately, just like the scanner that you showed me, just like the tumor, what is it called that I don't remember now? What was your position? I mean, you got 5 or 6 months left. People, damn, you went too far. He answered me privately. The doctor told me 3 months, and you give me five. You have already given me 2 months of life. I say, see, well, I have given you 2 months of life. I want to say that I have given myself a little joy, but you see, it's not even going astray. I want to say that you wanted to look for a question, that the doctor had answered you, and I had answered you the same thing. I want to say that the truths have to be said. We don't have to remain silent, and diseases are what they are, and that's why a person says, nothing is going to happen to you. They operate on you, and that's it. If it is a lie, you have to tell the truth so that the person who is going to operate or undergo treatment knows what is going to happen to him. Is it like me when they told me you are going to drink Fentanyl, and what is this Fentanyl? Is not a clear thing. I had read about the United States, people on the street, and I said, no, no, no. If it is taken with a controlled medical description, under medical control and all this, nothing is going to happen to you. You are going to make a good life. The pain has taken away from you, and it is true, but if yours, I lose control and I abuse like abusing alcohol. If you drink one beer, nothing will happen to you. Because you drink 10 beers that you will end up drunk, well, this is the same. If you abuse, well, you will end up, and in my videos, well, I tell the truth just as they are. If this hurts, it hurts if it is facial. You have lost it, your face is going to be crooked, as always, like I have it, and there is nothing to do. At most, put vows to fix a little on the other side. But you are always going to have it crooked in your mouth, and the more you talk, you are going to have it crooked, and you have to tell the truth. You cannot tell a person who has just had surgery that they have had their facial cut, that they are going to recover it in 6 months, like many genes. It's not that I'm coming. Maybe I'll get it back in 6 months. Did they cut it off? Yes, you won't get it back. The truth is, if they cut it off, you won't get it back. No matter how much they make you recover, whether they have only touched it and it has become inflamed in 6 months or 1 year, you can recover it perfectly. But if they have cut it off like me, it does not recover because it cannot be recovered. And that is what people, doctors sometimes don't want to say, and they call me so I can say it. And then when I say it, damn, you've gone 2 towns saying this. No, I told the truth. They cut your face off. You're never going to have a facial again. Get tired of it from there. Assimilate it as soon as possible, because more than assimilating it is more nonsense. Being told you will not recover. They have cut it off from you. If they have cut it off from you, you do not recognize them as a person, unfortunately, who is disabled, that his leg has been broken, his spinal cord does not recover, no matter how much they tell you at the gym that it is not going to recover, no matter how much it is to deceive people. And nowadays many do it. I say to take the fleets to Puebla. No, in 6 months you will be able to recover more. When you reach 6 months, not 6 more months. And when you arrive the year that they already see that you are a little stronger, you say to yourself, no, this will not recover. Well, I say from the first day, this will not recover, and you already know that it will not recover, and no, and you already think from the first day that it is going to make your face crooked. And that's it. That they deceived me, they did me. It makes you recover. And in the end, they told me, no, this does not recover. That was with the shy one. I have the shy one, not the shy one. If it happens to you, take some pills that are so. Look, I took them. I finished saying, look again. And he told me, don't take any more, because this was my whole life. And I say this, you couldn't say it on the first day, because of course I didn't do it from the first day. And I no longer think that I was hoping that I would be cured by taking the pills as a shift every day. Doing what they told me like a fool every day to carry out 6 months and tell me, you'll never recover then. Well, no, I didn't like it. I was kicked in the ass. It felt terrible. They explained everything to me very, very, very cut. Not from here, 6 months we talk about, from here, 6 months we talk about, from here, 6 months. Everything was from here, 6 months. We will see from here, 6 months. And in the end, after 5 years, he tells me the headaches are chronic. It's facial, as you already know, that maybe it will recover. He's shy all his life. Damn. I would have started this because on the first day I don't have stupid illusions, I get mental. And then what I think is better, I don't know. Well, guys, I'm giving you a shit, but that's what I wanted to tell you now. So I don't know if maybe it happens to me sometimes, and I'm 16 and you run away a little, and I'll notice you. But if not, I'll go away, telling the truths as they are. Okay, guys, greetings until the next day. Goodbye.